Thank you for the intro, Anita. I'm Cheryl. I'm one of the public health residents, and I've been working with Dr. Michael Schwandt, who's the MHO at VCH, and working with the Healthy Environments team. And so thank you so much for having us speak about some of the work that VCH's environmental health or Healthy Environments team has been working on. We're gonna just talk, there's a number of things that VCH has been working on, but we're just going to focus on two projects, Megan's and myself, related to check-ins for vulnerable populations during extreme heat events, as well as a policy project to inform advocacy efforts to introduce indoor heat regulations. So before we go into that, it's obviously extremely important being on working with the Healthy Environments team. We're a group that works to improve the space around us, and the space around us is we're occupying it, and so it's extremely important that we recognize that it's nations who are the traditional stewards of this land, and so for ourselves today, we're presenting from Vancouver, which is on Squamish, Musqueam, and Tsleil-Waututh Nations territories. Next slide, please. Okay, please take it away, Laura.
Okay, so this is just a quick intro. For those of you who don't know and who we haven't managed to touch base with yet, VCH has rebranded their Healthy Built Environment team to the Healthy Environments team as of late 2021 to allow us to better respond to issues that relate to climate change. And as a result, it's allowed us to actually increase our response to climate change and health concerns. Historically, we've had enough capacity with our environmental health scientist, Emily Peterson, to update our annual letter to municipalities and as other health authorities have done, as well as update our health and smoke fact sheets annually for licensed childcare and long-term care facilities. But with the new frame of the team and Cheryl finishing, or I guess doing her residency, and Megan we're stealing from contact tracing, it's allowed us to increase our heat capacity, which has included providing joint presentations to local governments and non-government agencies with Fraser Health and HEMBC, writing a joint letter with Fraser Health to landlords and stratas to ask them to consider the different ways that they might present barriers to cooling units, supporting BC Housing in a temperature pilot to identify different measures that might be taken to reduce the heat in the housing units. A number of City of Vancouver activities, including contributing to the creation of cool kits for heat vulnerable people, assisting with their second indoor temperature survey questions to gather data on temperatures and associating them with different building typologies, advocating and starting the conversation to try to start changing the building code, which has resulted in an update that Cheryl will speak more to later on, and developing a supplemental heat check-in document for organizations to assist them with the implementation of the recommendations coming from the NCCEH BCCDC documents that Megan's going to now elaborate on.
Great, thanks so much, Laura. So as she mentioned, we're now starting off this, or we've been working on for a while now, this extreme heat check-in supports project. So this came out of a lot of Sarah Henderson's work with the BCCDC, and just of the analysis that's happened after the heat dome last summer. It's been recognized that there was a huge increase in death in the community, which is absolutely tragic, but it also represents an opportunity to try to improve outcomes during heat domes. So our team saw heat check-ins as a way of hopefully trying to improve things in future heat events. So we put together this heat check-ins project. So I'm hoping to share a little bit today about what we've learned, what we're continuing to do, and also things that can be done sort of in future seasons, and maybe even things that your organization will pick up the baton and carry on this work with as well. So we started in April, and we were trying to identify organizations that were touch points for these heat vulnerable folks within the community. So we've learned that many folks that passed away last summer were very socially isolated. So trying to think of where these people might be going into in the community, which organizations would serve them, and how we can best engage with them. You're wanting to really understand the landscape of check-ins. So is anyone currently doing them? Is there, if they are doing them, which type of organization, which populations are they serving, what resources can we provide as VCH to support them in that work. And if they're not doing check-ins, what would it take to sort of help empower them to do that? So in April and May, we were engaging with these organizations as well as municipalities. Some of the organizations were nonprofit housing organizations, neighborhood houses, seniors organizations, cultural centers, faith-based organizations, those serving people experiencing mental health and substance use challenges, as well as market housing managers. So through that engagement, we were able to get a sense of sort of what was needed and what resources and training we could provide. We're currently in the stage right now where we're just finishing off our resource, and we're hoping to have it ready to distribute in the next week or so. And then after that, in June, we are looking at doing broad distribution of our resource as well as those of our partners on heat preparedness, and then also trying to offer training and presentations and events within the community, just really to get the word out to as many people as possible and to help people understand that check-ins are something that's accessible, that those without health training can actually be involved in. So what did we learn? There's others doing similar work. So Hey Neighbor Collective, for example, is doing really fantastic work around fostering social connectedness with the guise of emergency preparedness. So trying to build those neighbor relationships and help them sort of create emergency plans, some of which are heat response plans. BC Housing is doing absolutely amazing work focusing on the buildings that they manage as well as those that they fund. And they've created postcards, for example, that you can stick onto a door or put through a slot that sort of that help with check-ins. So, hey, we came by to see you. Here's some heat information. Can you give your building manager a call? They're also putting together other resources for buildings on how to manage their buildings and their organizations during heat. So that's a fantastic resource that's already up. We also learned there's a wide context for these check-ins. There's a wide variety of folks that are already engaged in these check-ins. So that's supportive housing, nonprofit and market housing, adult day centers, faith-based organizations, neighborhood houses, cultural centers, and even community members. We've had community members reach out who are really engaged and wanting to be involved and looking for ways to get their building participating in these checks. We also saw varied interest and capacity. So talking to municipalities, we've realized that many of them are not there yet. Understandably, they're really busy with their own heat work. There may be other priorities within their communities, or there isn't the capacity, or there needs to be a better understanding of, the connection between health and the municipalities. So if they're checking on someone, for example, how is health supporting their staff? If there's an emergency, who can they contact? We know from last summer that there was some challenges with 911. So, where is the health support for that? Social services, we were hearing that many of them understandably don't have the capacity. They were doing a lot of these checks last year off the side of their desk, off of funding that their existing funding. So doing additional work is something that's going to take more capacity and more funding. There was outliers. There's folks that were engaged in checks, really keen to be involved in checks, and those that are just don't know anything about checks but really want to be involved for the coming summers. We also learned that there's folks that may not be ready to be involved in checks, but they're wanting to distribute resources and really educate the public on this. There's diverse knowledge bases. So we're looking at everything from folks that are working in supportive housing who, maybe most of the staff have some first aid training or maybe even a healthcare background, all the way to community organizations that really stepped up last year and saw a need for these check-ins, didn't have the training, but just jumped in anyway. So folks that don't have much understanding of or just learning about, things like heat exhaustion and heat stroke. So are really trying to build that capacity. One response that we got through a survey that was done with our partners at City of Vancouver, someone who was asked, what would you need for your organization to do check-ins, responded, everything relevant from start to finish, as this is all new to us. So there's these organizations that are very keen, but they're wanting education and support. We also learned that there's lots of organizations that are looking for that connection to health. So if there's challenges, how do they contact health? Do they go to a clinic? Do they call 911? If 911 is having delays, then what do? Is there other people they can reach out to? And then also wanting to have an understanding of emergency roles and responsibilities. I think many of us that work in healthcare or in community services know that it's a complex system, even for those of us who are in these services. So I think if we're going to be getting community organizations involved, it's helpful to have them understand where they fit within that larger picture. So what are we doing for this season? So as I mentioned, we're developing our own resource. So from our conversations with organizations, we learned that the gap there is people wanting to understand how as an organization they can run check-ins. So, the BCCDC and the NCCEH are creating this fabulous guide that's going to be sort of a 1 to 2 page, how do I do a check-in? I can pick it up without any health training and have an idea of how to go about this. But as an organization, how do you actually structure those checks? So that's what we're creating. It's a heat check-in framework for NGOs. We're looking at trying to meet the needs of a broad audience. So we're trying to have it be relevant for folks, even serving those with substance use and mental health challenges, all the way to those that are just, community members that are wanting to get neighbors together, for example. We are trying to answer common questions in there. We have a 4-page FAQ that's all those scenarios that we were hearing about, those questions that our partners kept mentioning of, there's a standard check. Okay, you look for someone and they're doing great. Wonderful, but what if that's not the case? What if there is challenges with mobility? What if they are in distress? What if there is challenges with 911? What do they do? So we're hoping to have some answers for those questions. We also have printable tools in there for organizations. So a heat check-in workflow for people doing the checks, as well as resources. So common helplines, phone numbers. And the big thing I think that's going to be helpful as well is we've included our team's email and a phone number so they can actually connect in with health. So if they're having challenges creating these organizational plans, if they're having challenges with their heat response planning, or if it's an actual heat event and they need to contact health, how do they do that? So we will actually have our information in this guide. We're also looking at doing training presentations and sort of that broad distribution of resources. So, pushing across all of those communication channels as soon as we can. We're looking to build collaboration and partnerships with these municipalities and NGOs. So this is, I think, really the first step in a lot of this heat response. I think people across the province are recognizing that. Everyone's very busy doing their own work in relation to heat. But I think this coordination and emergency response, it's really built on those relationships, especially for folks in community. So how do we bring them to the table? We know that they have the lived experience. They know best what needs to be done at their level. They're often the ones that are the quickest to respond or to mobilize during these events. So how do we actually involve them in this conversation? Also looking at, those relationships for mitigation going forward. So Cheryl will speak to that a little bit with her presentation as well. So what else can be done? Things that we're looking to do in future seasons, maybe things that your teams might take up in future seasons. So heat check-in resources for specific populations. Like I mentioned, ours is quite broad. We're trying to touch on a few points here and there, but the reality is you're not going to get everyone in one document. So I see there being a need for a specific guide for folks who are serving people with mental health and substance use challenges. We might be doing check-ins that are maybe a bit more complex, or maybe a guide for landlords and market housing managers. Is there a way to have them do a pre-season message that goes into the door and helps them identify folks who want check-ins, and then a guide for how they would respond from their role as a building manager and potentially dealing with residential tenancy grants, for example. There's been mention of a registry of checks. How do we coordinate all these? I think many partners are trying to sort of look at this and realize that it's something that needs to be have further attention. So if anyone wants to take that up, I really encourage you to. We have partners like Renfrew Collingwood Senior Society who are really leaders in this work, and they're actually doing a registry within their neighborhood of organizations and across adult day centers. So maybe it's not a registry across the province, maybe that's not feasible, but maybe it's within neighborhoods and within regions. And looking to kind of create those connections between health and community, and then also across different community organizations. Maybe one of them has a bus, but they don't have a cooling center, and another organization has the cooling center. And so how do we kind of make those links and help them with those links potentially? Maybe that's something that we can do with that coordination. Also, tech's been mentioned. Someone said, hey, can we create an app for that? Is there a way to identify buildings that have already received checks? Or maybe even individuals. There might be sort of challenges with privacy and confidentiality there. Another piece that could be engaging and funding community partners. We know there needs to be more funding for community partners. If we're bringing them to the table and we're recognizing this amazing lived experience that they bring, are we able to provide additional funding and even better funding structures? We had people saying, it was challenging trying to apply for a grant in the middle of an emergency. So how do we kind of address some of those systemic issues? And so looking, like I'd mentioned, sort of programs for social connectedness. So this summer, I think that's going to be a huge piece. You know, the municipalities aren't quite there yet. Some organizations are, some don't have capacity. So how do we really encourage members of the public to think about all their neighbors, their family, their friends? Are there programs that we can do to help facilitate these relationships? I think, like I mentioned, Hey Neighbor is doing some amazing work. Maybe there's things that each of us can think of within our organizations that we can do to contribute to this social connectedness. So that's a few things that we've learned, and hopefully a few things that might maybe spark some ideas for yourself or your organizations. And I'll pass it over to Cheryl.
Thanks, Megan. So this would just be a quick switch gears to a completely different project at VCH that I'm leading. And it's really to think about the future and think about policies and regulations pertaining to heat, and especially indoor heat, to prevent deaths and prevent heat-related illnesses that are a result of really high, dangerously high indoor temperatures in people's dwellings. And so in summary, the project that I'm leading is to try to identify any policy avenues about this and try to look at what are the barriers and also facilitating factors to introducing any policy pertaining to indoor temperatures. And I can go on to the next slide. All right, so our approach to this, it really stems from our understanding that heat and cooling in your apartment, it's not just a matter of comfort. As the climate change, it's going to be more and more a matter of health and safety. And of course, we saw this from the heat dome last year, and we will continue to see illness coming from heat waves, especially as they're going to be more frequent as the climate changes. And so, you know, this is a headline from last year, but next week there's actually going to be the coroner report reviewing all the heat dome related deaths coming out, which will go into detail more about the deaths that occurred last summer because of the heat dome. We do know, though, that majority of these deaths, they occurred in people's homes. So they weren't occurring in hospital or in long-term care facilities. Those are folks who, you know, alluding to Megan's project, who are not socially isolated because they have people to check in on them. Or it's really the people who are socially isolated, live alone, who may struggle with mental health or cognitive decline, who are most affected. And so with this project, again, we're trying to look at it from a policy perspective, like what can be done to protect people's homes in the community through regulations. Next slide, please. All right, so there's, you know, plenty of laws and regulations that enable safety in people's living spaces that we're used to, you know, fire regulations, plumbing code, and lots of stipulations in these building codes and in tenancy laws that have standards and requirements built into these policy tools that protect us against things like the cold in the winter. So for example, this is taken from the BC building code on the left here, where there are minimum temperature requirements for residential buildings intended for use in winter months. And so the idea is, if there is a minimum temperature requirement, what would a maximum temperature requirement look like if that were to happen in BC? And again, with the idea that it's not just about comfort anymore, it's about health and safety. And then on the right, looking at rental laws. So provincially in BC, the Residential Tenancy Act, it doesn't have a minimum or maximum temperature requirement, but it does allow municipalities to introduce bylaws themselves if they so wish about this. And so in BC, there's 22 standards of maintenance bylaws in municipalities, so very not that many, and then fewer yet, 11 with a minimum temperature requirement. So again, this is just looking at different ways that a temperature-related policy could be introduced in our province and our region. Next slide, please. Yeah, so applying that same concept, not just to heating in the winter, but cooling in the summer, seeing how we can have some minimum standards for cooling in the summer to protect against extreme heat, especially during events. Next slide. So another concept that is informing this project is not just needing passive cooling, like from shade, but also the need for more mechanical cooling, so as in air conditioning. And so I just want to quickly share some work done from the city of Vancouver, Vancouver Coastal Health, namely Emily Peterson, who I think is on this call right now. She's the environmental health scientist at VCH, as well as BCCDC. And so last year they did a indoor air temperature survey in Vancouver, looking at a self-reported survey of indoor temperatures. About 150 respondents living in Vancouver recorded temperatures in their home during the heat dome and in 2 subsequent heat waves. And so here you see that a huge, apart from this outlier, the mean maximum indoor temperature was 34.1, extremely dangerously high during the heat dome. Next slide. And importantly, they looked at all sorts of different factors in a home. So here up on the top left, looking at what floor that people lived on. At the bottom, what age was their building, before 1970 to all the way to after 2010. In the middle, they looked at the direction the window faces. On the bottom right, we're looking at if it's a condo, duplex, single. But the most important factor, the thing that made the average of the home below 30 degrees is up on the top right. You see that it's having central AC that really makes that difference. So all those other factors, the direction your window faces, the floor you live on, the age of your building, et cetera, of course it plays a role, and certain pieces of it make you more or less likely to experience high indoor temperatures. But really it's the presence or absence of central AC that will make the biggest difference for your safety. And next slide. Okay, so I talked a bit about already a couple of the policy mechanisms, like the BC Building Code and the Residential Tenancy Act and some municipal bylaws as well. And I didn't mention the National Building Code, but I'll go into that in a sec. The idea being that, there's all sorts of different ways to get to the same goal of enabling safer indoor spaces in people's homes. Next slide, please. And so what's really important, what has been really important to recognize in this project is that there's all sorts of different policy avenues, but all sorts of different building types, building ownership types, even different ways of introducing air conditioning. And so in terms of different building types, I mentioned it matters if they're a single detached unit or multi-unit, the types of regulations that would apply. It matters the number of stories that a building is, over 3 or under 3, that the specific type of building code might apply to. And then the age of a building is more actually that it's whether it's a new building or an existing building, again, would have different regulatory pieces that can be used to introduce temperature regulations. And next slide. And then also there's, of the different building types, there's also lots of different types of ownership, whether it's an individual type title, so an individual owning a home versus a home that's part of a strata. Again, there would be different regulatory pieces that can enable or pose a barrier to somebody having AC in their home. Rental apartments, social housing is huge. So again, considering that there's different ownership types in people's homes, and that would dictate the different policy mechanisms that are needed. Next slide, please. And then finally, there's also different cooling types. So I mentioned passive, but even just for air conditioning, mechanical cooling, there's central air conditioning, portable air conditioning. You could have regulation that for example, requires cooling in just the hallways, or cooling in a designated cooling area, for example. And so again, there isn't necessarily just one type of policy or regulation pertaining to indoor temperature. Next slide, please. All right, so at this phase of the project, we've been basically interviewing a number of key stakeholders involved in involved. And so, you know, recognizing that there's all sorts of different building types, all sorts of different ownership types and types of cooling, it was very important to map out all these different stakeholders and interview key informants representing each different group. So for example, local governments, we've been meeting with both large cities and also some smaller governments in the VCH region, recognizing that the barriers facing each city and each type of city can be very different. So for example, City of Vancouver, just a few weeks ago, actually, the City Council approved recommendations in a report that would require the city building bylaw for all buildings 3 stories and up to have mechanical cooling with a maximum temperature of 26 degrees. Meanwhile, a lot of the smaller communities, they don't have the capacity or the local government policy mechanism to do something like that. And so they really rely on provincial standards, whether it's the BC Building Code or a rental standard set by at the provincial level. In terms of provincial government agencies, it's a huge priority to speak to BC Housing and AMA because those are the ones who are supporting living spaces of those who are most vulnerable to heat illness. And so BC Housing is a huge leader in adaptation work for climate change and including for heat adaptation. And so it was really important to hear their voices. Advocacy groups, hearing from advocacy groups that represent the folks that these types of policies affect greatly and was really important. And so this is still ongoing. We've met with BC Poverty Reduction Coalition and still meeting with the other 2 very soon. And then industry organizations. So this is really in recognition that the solutions really need to come from everyone involved in housing. So, so in meeting with industry organizations, partially it's about education, conveying the health component to housing, especially in the context of heat, but also, you know, and helping relay the message that, you know, landlords or strata councils, they can be a big player enabling the safety of their tenants. And so we really need to get that buy-in as well when we're talking about any of these policies that affect them as well. So I think Laura mentioned earlier, but VCH and Fraser Health, we co-wrote a letter addressed to BC landlords and property owners in general to really encourage them to look at ways that they can remove barriers to cooling for their tenants. And so for example, like strata councils that have their own, you know, strata bylaws that prohibit installing portable air conditioner, really encouraging them to look at removing those in the absence of any larger policy. And then provincial legislation, we've been meeting with folks who are involved with the BC Building Code and the Residential Tenancy Act. And that's really important to understand the policy cycle that they operate on, the multi-year cycle. For example, the Provincial Building Code, those folks work closely with those who develop the National Code, but knowing that the National Code isn't going to come out till 2025 is helpful because then we'll know that the provincial one also won't come out a year or 2 after that. And so again, recognizing that it's a very long cycle from our, you know, advocacy perspective, trying to figure out on where in the cycle are there opportunities for us to again advocate for health and introduce that health perspective. Yeah, so next slide. We're just wrapping up those interviews now, and the next step in the project is to summarize these findings, summarize these key facilitating factors, key barriers that to indoor temperature policy that would affect, again, all sorts of different buildings, all sorts of different ownership types, different jurisdictions, regions, communities, et cetera, with the goal of formulating an advocacy approach that is multi-pronged, incorporates multi-stakeholders, but also, you know, recognizing that changes, any policy change, the consequence of that would require a lot of funding and also could have a lot of unintended consequences that we would try to identify early and mitigate as well. And so that's a summary of, yeah, the project that I've been working on. That's it.
Wonderful. Thank you. Thanks, Megan. Thanks, Cheryl. That was really great.